morning. I am Giuseppe Mallel, pathologist at SIAPeC Medical Analytics, and it's a pleasure for me this morning to present to you this case report. Artificial intelligence helps detect invasive breast carcinoma. This case report has been awarded by the SIAPeC, the Italian Society of Pathology, for the SIAPeC Case Report Award 2022 Breast Edition. Artificial intelligence can play several roles in the context of pathology, and this can range from quality control to diagnosis support, and in general it can increase the predictive ability of pathology. So here is the case. We are talking about a 30-year-old woman who in October 2021 underwent a biopsy of the upper quadrant of the left breast due to a suspect at imaging, and the biopsy turned out to be a ductal carcinoma in situ, negative for hormone receptors. But as the imaging was very suggestive of an invasive malignancy, the biopsy was repeated a month later. This time, the diagnosis was of multiple foci of high-grade DCIS with extensive lobular cancerization, again hormone receptor negative, but the invasion couldn't be ruled out. At this point, the digitalized slide of this case was submitted to the Galen platform, second read breast. This is a platform that provides a quality control on slides that have already been diagnosed, and in particular, it's an artificial intelligence based platform that raises alerts in case of major discrepancies between the report and the findings of the artificial intelligence itself, in particular in the case of invasive cancer or in situ cancer. In this case, the Galen platform secondary breast raised an alert for invasive cancer. And as you can see in this image taken at the low magnification, it showed several heat maps, red heat maps, in areas of high likelihood of invasive cancer. A closer look at these areas that received a high likelihood heat map for invasion were indeed morphologically suggestive of invasion, and the staining for P63 highlighted that they were devoid of basal cell, thus confirming their invasive nature. For comparison, other areas that had a morphology more in line with an in situ carcinoma did not receive an invasive cancer heat map, while they did receive an in situ cancer heat map, and the staining with P63 highlighted the presence of basal cells. These findings allowed the assessment of the prognostic and predictive factor of the breast carcinoma, and in particular the invasive areas were found to be hormone receptor negative. The Ki67 was pretty high, in some areas up to 50%, and very importantly the HER2 showed a positivity of 3+. All these findings allowed the revision of the diagnosis. So, thanks to the artificial intelligence, the diagnosis could be revised, and now the diagnosis was a multiple foci of poorly differentiated invasive breast carcinoma, hormone receptor negative, Ki67 50%, HER2 3+, with also multiple foci of high-grade DCIS, and this diagnosis allowed to pursue the correct treatment for this patient. And with this, I thank you for your attention, and I invite all of you to send any questions to the email address giuseppe.mallel@ibexscoreai.com. Thank you very much. Bye-bye.